So we know benefits of exercise, right? Strengthening the heart. The heart's going to pump more efficiently, reducing the strain to the body, lowers the blood pressure. So what's interesting is I feel like exercise can be as effective, if not more effective, than taking blood pressure medicine. And I'm not telling anybody to take their blood pressure medicine at this point. But I would have patients or clients come in and their blood pressure was right on the verge where I'm going to have to send you home and you can't exercise. I take their blood pressure. It's in the 150s, close to 160 over, let's say, in the 90s. After they get done with exercise, when I would recheck it, it'd be like a 120 over 70s. Like, you can't get better than that. So just by exercising, take your blood pressure before you go exercise. And then when you get back, take it again. And you can see how effective that is. So if you actually space that exercise out throughout the day, then you're going to get that lower blood pressure 2-3 hours after exercise, after every exercise bout. So you can actually create a lower blood pressure throughout the day just by having bouts of aerobic exercise. Keep that in mind. We know that it reduces bad cholesterol, if you want to say bad, and increases the HDL. When I look at people's HDL on their lab, I say, guess what? You're below 60. You need to be exercising more. You need to be moving more. Improves the blood flow, regulates blood sugar, reduces inflammation. I know Ryan helped me with some of the outline, and one of the topics was the 5 most powerful movements for heart health. I feel like one of the most important is just hiking in nature, getting morning sunshine as you're exercising. If you look at children, or I watch my grandbabies who are 1 year old and they only want to go outside, right? Or dogs, they want to go outside. They want to roll in the sun. They want to run around. They want to wrestle. My grandbabies want to sit in the sand and ground, right? So doing the best you can with getting outside, being with nature, because you're getting a double benefit, that you're getting the calming of being in nature, but you're also training your heart. I know Dr. Wolfson has been camping quite a bit, or glamping, as he says. And so he's probably grounding every night, sleeping on the ground. I just ordered a grounding blanket. So stay tuned, because I've had a lot of patients that have said, Dr. Rainier, I've ordered a grounding blanket, and by gosh, if I'm not getting the best sleep I've ever gotten. So I've had so many patients, I'm like, okay, I'm going to try it. So I'll let y'all know through Ryan here in the future. Does anybody have a grounding blanket, by the way? You do, Ryan?
Yeah, I love it.
And you've noticed a difference with sleep?
I have actually, yeah. Yeah, it's longer sounder is what I noticed.
That's awesome.
Yeah.
I thought to myself, okay, so what we need to start doing is if we do go outside and we're hiking, we have our rubber shoes on. So really it'd be nice just to maybe just sit after we're done, do a few stretches, but actually take off your shoes and put your feet on the stone or the sand, whatever it is, just so we can actually get some real grounding. So HIIT training is really important. HIIT training, and you think, oh my gosh, that's going to be something where I'm sprinting. But actually, it can be as easy as taking a 1 mile walk and just something that you've done daily. And you just basically increase the speed for 10 seconds, a little faster than you normally go. And then you decrease the speed back to normal for 30 seconds, a 1-to-3 or 1-to-2 ratio. Or if you did 30 seconds of a little faster walk, then you would do a minute 30. So 1-to-3 ratio again, a minute 30 of walking a little slower. But you could use distance. You could say, okay, I'm going to walk a little faster to that mailbox. And then the next 3 mailboxes, I'm going to go a little slower. So increasing and decreasing the intensity with your aerobic exercise is important because it makes the blood vessels expand and contract, right? As you increase in intensity, the whole cardiovascular system has to work harder. You've got more pressure in the system. It works the vessels. And then as you decrease the intensity, the vessels get to relax a little bit. What that's doing, it's creating the blood vessels to be more elastic, if you want to call them more youthful. So it's a great way to add anti-aging to your blood vessels. Good way to look at it. Swimming or rowing. So doing exercises that enable upper body and lower body. So the more muscle groups that are working, the more oxygen demand and the more increased work on the heart. Based off your fitness level, that's a good thing. If you're at a low fitness level, but you're rowing, you'll just have to go a little slower because it is a lot of muscles versus just walking is just the lower body. It's more calves, little hip flexor, not as big as muscles as the rowing or the swimming for sure. Body weight strength training at your level. Doing some strength training is important, such as we've talked about this before. Some of you have been in the meeting with us, but something as simple as wall push-ups, and you can Google those exercises. I think we even have them somewhere. I know Ryan has them. Standing and sitting from the chair squats, rows with tubing. We talked about the Turkish get-ups before from the ground. It's important to be able to get up from the ground easily. Can you do it? Test yourself after you get off this call. Go to the ground on all fours, and can you get up without support? Do you need the ottoman for support? You want to be able to get up on your own. Super important. And then doing all of these with a social connection, walking with a partner. I love that we're on this Facebook group together. This is social connection. Even better is in person. Just a pat on the back, holding someone's hand, affection. We have electromagnetic fields and we feed off each other's energy. You can think of people that you've been around and you feel, oh my gosh, I'm so drained just being around that person for a short period of time. So trying to find choosing people that boost your energy. I definitely get that from my grandbabies or my children. A lot of youthful people can bring in more energy. And it's not always just youthful, right? It's all different types of people. But social connection is really important with exercise. Get a 2-for-1, right? Let's see. How to use movement to lower blood pressure and inflammation. We talked about that. So the increasing and the decreasing of intensity, not just doing a steady state exercise where you're just walking on a flat terrain. You really want to have a terrain that increases the incline and then decreases and then increases and decreases. And you can play with that ratio from 30 seconds, pushing a little harder to a minute 30 up to a minute, pushing a little harder. And if you're just starting out, even 5 or 10 seconds, walking a little faster or pushing a little harder. Or if you're in great shape, you're actually jogging or sprinting. But I would say the average people here are probably moderate fitness level. If you're sprinting in between, then you probably don't need this lecture from me. You probably need the part of it where I tell you to take it easy and recover, which is very important. If as important as the workout itself is the recovery. Let's see. Exercise is the best blood pressure lowering medication. We talked about the patient that came in and after he exercised, blood pressure is way lower. But building heart rate reserve. So pay attention to your resting heart rate. What is it every morning? Hopefully it's somewhere in the 60s. It's going to be between usually 60 to 100. The lower it is to a point, the better. You want it to be closer to 60 ideally. It gives you more reserve. So if I've got a 60 resting heart rate and when I exercise, I'm at 150, let's say when I'm pushing as hard as I can, I get to 150 beats per minute. Well, look at the difference between the 60 beats per minute and the 150. It's pretty big, right? There's a big reserve there. So my fitness level is actually really good there. And I've got a lot of buffer in between. So if I'm not as fit and my heart rate is 100, 110, and my exercising heart rate max is about 150, I don't have as much buffer in there, right? Or reserve. Just me getting up and getting dressed for the day, I'm probably at 110, 120. So now I only got this much to exercise with. So if you have any questions about that, you can ask me, but I hope that makes sense that when you have a lower resting heart rate, you definitely have more reserve and more ability to walk a little faster, run, sprint, do all the things you want to do and have more stamina. It's a sign of a stronger heart. So movements such as rowing and swimming that we talked about, we're working more muscle groups is really great for decreasing inflammation because you're moving the body, more joints, larger muscle groups, and you're actually moving lymph. So by moving lymph, you're actually decreasing inflammation. That's how the body gets rid of the toxins in the body. You could think of it, I always tell people whenever you do like hot cold therapy, it's almost like taking a sponge and the hot brings the blood in, and then the cold therapy constricts the blood vessels and brings the fluids out of the tissue. It's like a sponge. Same thing with exercise. When I'm moving those muscles, I'm moving fluids through the body, through the muscles. And you can think of that also as wringing out a sponge. Moving the tissue, the fluids of the body is very important. What types of exercises can actually hurt you? So it's interesting. One of my patients, we were trying to figure out why he had an aneurysm. And he said that in his younger years, he completely overdid stimulants, massive amount of stimulants, pre-workout stimulants. And then when he would go weight train, it was competitive weight training. So they were doing the deadlift, squats, all that, but they had the weight belts and all the things that heavy weightlifters use. And so we came up with the most likely reason for him having the aneurysm was from that overdoing of the stimulants and the heavy weight training. So we don't ever want to overdo the weight training. You don't ever want to lift weights and hold your breath like you're bearing down, like you're going to go to the bathroom. You don't want to bear down like that and create that intra-abdominal pressure. That you want to be able to breathe through the exercises, the weight training. That's important. You can detach a retina. I've seen that happen from somebody lifting weights too heavy and holding their breath and bearing down. So you want to avoid that. That can be very dangerous. Excessive cardio. Marathon running is not for everybody. It can put excessive stress and strain on the cardiovascular system. So, Dr. Rainier, how do I know if I'm overdoing it? Things you can do. If you have joint pain that doesn't resolve, that's a sign of overtraining. If your resting heart rate is usually at 60 and in the morning suddenly it's 70 or higher, if it's up 10 beats, it's a sign of overtraining, overdoing it. Checking your heart rate variability. Very interesting to do. Of course, you have to wear a Apple Watch or whatever, and I know Dr. Wolfson doesn't like all that, but you could wear it for a day and see what your heart rate variability is. That you can see that when you are more stressed, your heart rate variability goes down. And when you are doing something you enjoy, like every time my husband flies, his heart rate variability just skyrockets. Or when he goes on his motorcycle, I'll like, does he like being married? Oh, he does. His heart rate variability is higher at night when he's with me. Kudos, right? At work, it's a little lower, so maybe he doesn't like his job as much. But you can see what you like or what you like, what stresses you by checking your heart rate variability. Very interesting. It's important to feel refreshed and not drained after your workouts. And recovery is as important as the workout. So again, tracking your resting heart rate as soon as you wake up in the morning. If you're a first person, that's great to do. Or tracking your heart rate variability. Simple, easy to follow strategies. Of course, listen to your body. Modify the exercises to your fitness level. So we're all different. And so exercise to you may mean 3 times a day, walking in your house for 2 minutes. If you're not a person that can get out of their house right now, or it might mean going on a great hike for a couple of hours. So everybody's different. Setting realistic goals is important. Things that I like to look at is, what is your HDL? If your HDL on a lab is under 60, I want you to do more cardiovascular exercise. Other labs that we check at Natural Heart Doctor, it's called ADMA, and that is a lab that checks your nitric oxide. If you are exercising as much as you should, that lab should be good. There's something that you can do besides that lab, and it's on our website. It's our nitric oxide saliva test strips that you can test your nitric oxide. And if it's low, you need to be doing more exercise. You might need to add some of our heartbeat and maybe some Vascanox, but exercise is part of building nitric oxide. So doing nitric oxide exercises such as deep squats, touch your toes, reach to the ceiling, touch your toes, reach to the ceiling, squats, jumping jacks, things like that builds nitric oxide exercises. Hemoglobin A1C, we know that lowers with exercise, right? And then insulin. High insulin feeds inflammation, feeds cancer. Exercise helps reduce insulin, specifically weight training. Weight training is very important. If your hemoglobin A1C, your blood glucose, or your insulin is high. And then let's see, the next topic, the secrets to make heart healthy exercise a habit. So find a group like this one. This is great. I know you guys started accountability partners. I hope that everybody has one. Getting out and doing that social connecting with others. Making things fun. I want to hear how you guys make things fun. Setting realistic goals, and that's individual for each person. Something as simple as walking after dinner, even if it's just 2 minutes. I'm lucky that I can go out back and walk for miles in my backyard. I've got a area there that everybody can walk or ride bikes, but not everybody has that. So even if it's just walking in the house, stretch while watching TV, put a stretch mat out in front of your TV at night just to sit down and do some movement. One of my patients, she puts 5 and 8 pound dumbbells in her bathroom. So she brushes her teeth, gets ready for the day, and then she does her bicep curls and she does her overhead presses and she does her bent over rows, one set of each, and then goes on for the day. It's just part of, she connects it with other things like brushing her teeth, getting ready for the day. That's just part of getting ready for the day, doing a few weights with the arms. Signing up for a 5K and walk the 5K. You don't have to run it, or a mountain bike ride, where you actually have something on the calendar that you're working up to. And then when you travel, when you have a vacation that you're getting ready for, it's like, how I'm going to walk every day because I want to be able to see as much as I can when I go on vacation, or I want to bike ride more because I'm going to go do a bike tour when I'm on vacation. I want to be able to keep up, or keeping up with your grandchildren. What does that take? Some good kettlebell lifts. Bent over kettlebell lifts is great for picking up grandchildren and not pulling your back out. So preparing your body for the things that are important for you, so when you get to do those things, you don't get injured. So those are very important. I guess I have some questions here that some people posted. Is Elizabeth here? She says, I am postmenopausal. What is the best type of exercise for me? Really, for menopausal women, postmenopausal women, is bone health is important. So the weight training is critical. Doing the strength training. So you want to be doing, 8 to 10 reps and feel like the 10th rep is about all you've got. And then doing 2 to 3 sets of those would be ideal for increasing bone health. And then always getting a reputable, a knowledgeable personal trainer would be great. Yoga and Pilates is great after age 50 because it's not as repetitive and jarring to the body. So something to think of. Another question, if a person has AFib, is it safe to exercise on a rebounder without the threat of throwing a blood clot? Yes, it is safe. Now, however, going in a jet and doing some G maneuvers is not very smart, but getting on a rebounder would be very safe. Nothing to worry about. Another question, exercise tolerance. I've got low cortisol, vestibular issues, and dysautonomia from a brain and neck injury. I've gradually built up tolerance to walking over the past year. On a good day, can do a half a mile, but we all know that's not where it needs to be. How do I improve? So my thoughts on that are take that half a mile and start adding 10% a week. But if you can't do that, then take that half a mile and do those 10 seconds of increased intensity backed with a minute 30 or 30 seconds regular intensity. Again, 10 seconds pushing it a little faster with 30 seconds at your regular speed. So you can take that same amount of distance and maybe just make it a little bit faster. And then being happy with the best you can do. Sometimes, we are doing the best we can with working and taking care of parents or children, whatever it is in your life. And so being happy with yourself that, you know what, I did the best I could today. That's important. Also, making sure you're working with the right functional medicine doctor that's helping you progress is important. Next question, how to improve my heart response in exercise? So when it comes to your heart, frequency is the key, that you can't exercise once a week and expect to make your heart improve. So it has to be at least 3 times a week, maybe more, slowly increasing intensity, the interval training, up and down a little bit. Important is making time for recovery. Sometimes when you push, the body has no time to get stronger. The heart is just like a muscle that you weight train. When you push and you strength train, you're basically tearing that muscle, producing inflammation. The body has to come in and heal it to make it stronger. Same with your heart. When you work the heart more intensely, you have to have a more restful day where you're just walking or taking it easy, maybe just doing some yoga on the down day. Let's see. Changing up the mode of exercise is good. We talked about rowing, swimming, using more muscle groups for exercise. Next question, how to build more muscle after 50? It's challenging. It's important to keep the repetitions. So for every set, say I'm going to do bicep curls and I'm going to do 3 sets. I want to do 8 to 10 repetitions at a weight that I can feel like that 10th repetition is all I've got. I could maybe squeeze out 11, but 10 safely is all I got. You don't want to feel like you don't want to grab the 2-pounders that you feel like you can do 100 bicep curls and do those for 10 times. That's a no-go. You have to find weights, dumbbells or weight resistance that taxes the muscle. That's how a bone grows. That's how a muscle grows. That's how you get stronger. That you want to feel like at that 8 to 10 rep range, 10 is about all I've got. And you do have to work up to that. So if you haven't weight trained, you wouldn't want to start out there. You'd want to start out with, I'm going to start out with 8 to 10 reps, but it feels like, oh, it's not that hard. And then I'm slowly going to build up to, oh, yep, now it's feeling like it's moderate. And then a couple weeks later, okay, now I'm lifting the heavier weights. And by the time I get to the 10th repetition, oh, that's all I got. I don't have 11. So it's working up to that. That way you don't injure yourself. Another question, ways to increase my ejection fraction from 36 to 40 up to 50% would be ideal. My thoughts on that are, first, find your root cause, and that's why we're here, looking at your toxins. Are you getting enough nitric oxide? And then we talked about the interval training, trying to increase and decrease the intensity appropriate to your fitness level. A lot of times people, it's not that their heart needs to contract harder. It's that the heart's not relaxing enough. And so we live in this stressful environment. We've got all these EMFs and blue lights and stress. And that kind of brings our stress level up to here. And you've felt the stress up to here before, right? And you know what that feels like. Your chest feels tight. So doing exercises that bring that stress down, that allow your body to relax, it actually is going to allow your heart to relax more and fill with blood better, which automatically gets the heart pumping better. So consider relaxation exercises, vagus nerve training, yoga, whatever it is that relaxes you. Acupuncture, you have to find out what works for you. Epsom salt bath, turning on Seinfeld, belly laughing, whatever it is. Find out what works for you and improves your vitality and gets you to relax. That's good for your brain. That's good for your heart. And then other things, look at your nitric oxide level. Get those Berkeley test strips on our website and test your nitric oxide level. Make sure that the heart is getting the blood flow it needs. Oh, so testing your RBC magnesium. Magnesium helps the heart to relax more. CoQ10, Getting a nutrient test. Do you need CoQ10? That brings energy to the heart. D-ribose. So these are all things for congestive heart failure. The D-ribose, the carnitine. But like Dr. Wilson says, test, don't guess. Are you low in CoQ10? Do you need it? Are you low in magnesium? Instead of just taking things, find out if you need it. Are you deficient in it? Are you deficient in carnitine? Fish heals the heart, and then the herb hawthorn is a great food for the heart. All right. That's about what I got. Along with exercise, I just thought consider sunshine daily, take a beach vacation, watching the sunrise every morning. Sleep is important, and then trying to get some grounding. I think in the future, we're going to see more of that with helping the body become healthier from the inside and doing things, just making our organism stronger, trying to take away some of this light EMF, all the things that are bringing up our stress. So we're on the journey together, guys. Any questions? I love HIIT workouts, but they don't have to be sprint to walk. It can be like we talked about. High intensity interval training can be taking a mile that you're walking, and for 10 seconds, walking a little faster, and then normal speed, and then walking 10 seconds faster, 30 seconds normal speed. That can be high intensity training for someone that's just starting to exercise. It's all relative to where you are, and it's moving in the right direction. That's what's important. Number one supplement for preventative heart health. Oh gosh. I can't choose one. I talked about those main ones for heart failure, but again, it's more personal. Some people I test their RBC magnesium and they're already good. So I'm like, okay, well, you don't need that. Okay, let's look at your CoQ10. Yep, I've seen people that have had chest pain. Their CoQ10 was bottomed out. We gave them CoQ10 and that's all they needed. It's so nice when it works out like that, when it's that easy. That's not the norm. It's usually all sorts of things that we have to work on, and it takes time. Yeah, too many things. Eat more fish. I can't choose, guys. Sorry. What about knee issues? Any advice? So knee issues, first of all, what's causing the knee issue? Leaky gut, immune system issues, fix that. You'd be surprised. I would have clients come in and say, oh my God, my knees, they come in hobbling. I cannot exercise today. And just by using massage stick on their IT band or foam rolling and getting, the areas that allow the knee to track better and loosening those up, you'd be surprised that could be. And then they're like, after we do that, they're like, okay, let's go. And they walk on the treadmill and do all their exercise with no pain at all. But they limped in and left, not running, but yeah, feeling great. So look at myofascial release, look at chiropractic care, stretching. A lot of times it could just be tracking and weak and tight areas. So the IT band tends to be tight, can pull the patella, and then the inner thigh can be weak. So physical therapy, PRP injections. Come see Keith Schmiegel. He's here next week talking. Cindy, I would definitely talk to him about your knee. Definitely some of these injection things have been great, but finding root cause, because it can be from the gut all the way to just weakness or tightness. So yeah, and to get around it, usually a recumbent bike is very gentle on the knees. Water aerobics, swimming, all those things are great for knee issues until you can resolve them. Huh. Can you recommend the grounding blanket you use? Yeah, Ryan. You have to tell us what you got.
I got mine from Therasage, actually.
Okay.
Yeah.
I see that. Oh, nice. We're all going to be trying this together, right? When really we could just go out back and put our feet in the sand. Why is that so hard?
It's so comfortable though. It's super comfy.
Okay. Something about a saliva test. Yeah, when you guys come in for appointments, we do the saliva test, but you can order those online. They're not expensive.
Cindy was asking about your thoughts on a electric bike and the use of that.
Electric bike?
Yeah.
So are you talking like a hybrid where you're exercising but has electric motor?
Yes.
I think they're awesome. I'm trying to get one here.
Okay.
They're not legal here out my back door, but I'm like, I'm only going to try to keep up with my husband. Yeah, it allows you that you can still get exercise, but still feel like you can keep up with other people that are more fit than you. It's
Yes.
excellent. I love it.
Thank you.
Yeah. And it's got a boost mode, which is great. But like I told my husband, I'm like, you have a boost mode and you don't even have a engine on your bike. It's not fair. So
Thanks so much.
great investment. Yeah.
Perfect. Thanks.
Yep.
I just wanted to, this is Alita. I just wanted to mention how grateful I was to do a discovery call with Sarah Rose. And there's other ones there, and it was really helpful. And I'm looking forward to meeting you, Tanya. Yeah, I really am. I just have an answer because I have to leave all the time to go out of the state, but it's just, I don't know if you guys feel the same way, but I feel like I've had PTSD with this thing. It's like when my heart raced to 250 and I had firefighters in the house and I was like freaking out. I just can't get that out of my head. I talked to Ryan a little bit about some of he has really good ideas too, if you ever wanted to get an appointment with Ryan. But just, and I don't know if you ever feel that way, it's like I live in Arizona, so it's almost like I'm waiting for the scorpion to come out of the corner. It's just like they're for no reason, they just pop in your face. I just need to believe that I went about 8 months without having an episode, and then I had one once a month, and then I had one twice a month, and right now I'm on a good trajectory, but it's just, I'm doing all the supplements. I'm grateful for how I feel each and every day. When I wake up and I have a great night's sleep. I've been tested for sleep apnea. I've done all the stuff. And there's just something about like always anticipating when the next episode is going to come. And I don't know if you guys can relate to that or if you guys do have AFib at all, but I've never in my life ever been sick. I've never taken a drug. And so for me, it's just like shocked me that I had that. I'm glad you can, Cindy. You feel so alone sometimes, but I'm grateful for the natural health doctor. And they actually are about 3 blocks from my house. So I have no excuse not to go over there and get these wonderful supplements. And grace of God, I'm not taking any blood thinners. I take their flow. I'm grateful for that. Yeah, traditional medicine, I'm in the healthcare field too, and they just have a habit of freaking you out, scaring you. And what about this? And what happens if this happens? And I don't know. It's a hard thing. It's a mindset. It becomes a mindset after a while. After you have all the testing and you meet with all these great people, it really becomes our own thing that we have to overcome. I don't know if Dr. Rainier, if you agree with that or not. It's just, okay, you're doing good. It's just that anxious anticipation that, I don't know, it's just hard. It's hard not to know what to do or if I should do this or that, or maybe I'll try a little bit of this now and see if that is a trigger. I don't know.
I think working with your doctor for sure, working with us, but also if you feel like you've got some anxiety, negative or your brain is constantly repeating, having worry, then that could be with a counselor. It could be different type of modalities that are out there. There's so many now, the heart math. Yeah, lots of types of different counseling techniques. And then also looking at the gut. Is the gut why the brain is having some anxious thoughts? And like you said, the PTSD, why are you having the backfill of that? Getting on board and looking at different supplements, but also acupuncture, counseling, things like that to support you until you find more of the root cause and you can keep those things from occurring again.
Yeah.
Yeah.
I do acupuncture and chiropractic also.
Wonderful. So you're
Mhm.
definitely on the right path.
Yeah, thank you.
Thank you, Alita. Anybody else want to share how they make themselves exercise every week? Sheila, aren't you my gardener?
Yeah, I garden a lot.
Yep. My gardeners are the healthiest people. I'm telling you. If you want to get healthy, start gardening. Oh my goodness. I listened to a podcast today, Bruce Hoffman, and he was talking about he has his patients, his chronic patients, move towards the equator. So if they're up in Canada or Wisconsin, Chicago, move south, get closer to the sun. Now it says cranial sacral. What's the question?
Oh, hello, can you hear me now?
Yeah.
I was just asking, what are your thoughts on it? I haven't ever done that before, and it was suggested to me one time. So I was just wondering, has it got a possibility of good use for people, or
Oh,
got any?
craniosacral manipulation. Yes, that's on my to-do list of things to try out. Definitely.
Oh, okay.
I've heard profound, a lot of naturopaths do it also. They're trained in it, but I've heard profound changes from that. So definitely
Well,
add to the list.
I've got an appointment for Tuesday to try it out, see what it's like. So
Where are you
I've done
going?
What?
Where are you going for it?
I'm in BC, Canada right now, and there's a place in Osoyoos that's got a number of places. They're pretty upbeat on health, like natural health stuff here. Anyways, what works for me, I was trying between 1 and 2 days, and I will work different muscle groups, but I have no matter what though, I have a day in between when I go to the gym, and then it may be a different muscle group the next time, but that way you should have a full chance of recovery, yet you've burned off some of the energy that might keep you up at nights if you don't get it off your system.
I can tell you have a lot of energy. Can y'all
Okay,
tell you've got a lot of energy?
I don't. It's not, put it this way, sometimes at about 4 o'clock in the morning, I'd be willing to give everybody else some. I want to be sleeping.
Yeah, I definitely want to check your RBC magnesium.
I take about 500 grams of magnesium. Some of it is the Magna 5. I take
Yeah.
2 of those, and then I also take an extra diglycinate, and I usually take them at bedtime.
Perfect. I wish you the best of luck. Sounds like you're doing the best you can as of right now, right?
Oh yeah, and if you sweat it, it'll get worse, right? So you just say this is the best you can,
Yeah.
and it's good, and you got your self-talk. So if you,
Alita.
I'm not saying I'm perfect at this, but when you do the best you can, and got to trust your intuition more so. I'm learning about that. I'm sure Ryan's got stuff he could teach me, but him and I think along the same line, although I don't think him as advanced. But for your own personal area and what you discover in an amateur way, you try to put into effect, right? So you talk nice to yourself. You got to, because nobody else does that
Nobody
much.
else is gonna.
So, and I've even said that advice to other people. I say, don't be so hard on yourself. Talk nice. There's worse things that you can yell at yourself about, not this one.
Yep.
So-
Yep. I'm doing the best I can every day.
Yeah, I have a motto: do what you can do that you can do each day.
Well, thank you for sharing your story. You're motivating us, James. I guess we want to wrap, Ryan. We should
Yeah,
wrap.
this would be a good spot.
That was fun.
Yeah, absolutely. Let's wrap it up then. Thank you so much, Dr. Rainier. Always educational. I love the fitness stuff. And I'm still doing some of the exercises you taught us last year from the last challenge. Those Turkish get-ups for anybody who's interested in something. A very cool exercise.
Google
So,
those. Google those.
yeah, Turkish get-ups. Thank you, everyone. Have a great rest of your day and enjoy your weekend. Get in some of those exercise tips, getting outside that Dr. Rainier talked about.
Happy Friday. Bye.